Thank you so much for having me talk to you today. We know that patients with advanced triple-negative breast cancer need new treatments. Chemotherapy remains the standard, and there are some opportunities related to immunotherapy, but even those additional treatment have produced little additional survival benefits. So we sought to find new treatments for those patients. And our colleagues in the laboratories have demonstrated that modulating epigenetic changes around the DNA can enhance response to immune checkpoint inhibitors. And this has been shown in breast cancer cell lines, colorectal cell lines, and also in lung cancer. Based on that, we initiated a phase 1 and a phase 2 clinical trial in which we start patients with entinostat, which is an HDAC inhibitor. The patient undergo a baseline biopsy before starting the HDAC inhibitor, and then after 2 weeks. And then at that time, there's a dose escalation in the phase 1 cohort where the patient received nivolumab, and then we escalated that. And then at the last cohort also added ipilimumab. And the goal of the phase 1 study was to look at toxicity, efficacy, and also whether there's modulation of biomarkers. I mentioned there was a biopsy before and after the 2 weeks of entinostat run-in, and then there was actually a third biopsy after a couple of months on the combination. And our goal was to see whether by providing the HDAC inhibitor first, we can produce some epigenetic modulation that will enhance response to the immunotherapy agent. And as I mentioned, this was the phase 1/2 study. The phase 1 portion is complete, and this was done in all solid tumors. And we